junior doctors greedy to ask for a 29% pay rise? 0207 862 2222 is our number. Junior doctors are now called resident doctors. They're threatening to strike again. The BMA, British Medical Association, is balloting its 50,000 members for fresh strike action that would last until January 2026. We've made it really simple here, thanks to producer Ellie and director Dan. These are the 4 key numbers that we need to remember, all right? So they want 29% now. They got 5.4% this year on the back of the big post-strike deal, which was 22% last summer. And the average starting salary is now 38 grand. So they strike, get 22%, a further 5.4. Now they want 29. Carole.
It's abject greed. That average starting salary, that 38 grand, only lasts for about the first 3 or 4 months of when they start.
Well, they say they paid less than baristas.
No, yeah, that's been disproved a million times over.
Baristas don't have pensions.
The difference between a barista and a doctor is a doctor can go up to 250 grand a year quite quickly, whereas a barista cannot. It's a job with a sliding scale.
Not quite quickly.
Yes, they
Not
can.
Quite
within 6 or 7 years,
a barista can't heal a broken nose.
Well, neither can a junior doctor in his second year. But anyway, but this is greed. This is driven by the BMA, which is a union of militant trots. You know, the BMA used to be a really respected union. It used to care about the NHS, used to care about
militant
patients.
trots.
Yes. I did say that.
Trots is, for those people watching from the 21st century, this is a reference to extreme left wing. Yeah, I just think it's quite an obscure term.
Right. Okay, well, okay. Maybe it's in your world. But this, the BMA was founded in 1832 to actually share scientific information with doctors about cholera. Now it's just become a militant organisation that doesn't care about the NHS, that doesn't care about patient safety, that just cares about doctors' wages.
Phil, doesn't care about patient safety?
I mean, basically, okay, are they greedy? They want to restore the salary level they had. Hang on. They want to restore the salary level they had in 2008. That's an aspiration. I don't see anything wrong with that. Are they top of my list? I would give the pensioners the winter fuel allowance. I would restore I wouldn't cut disabled benefits first, but yes, they should. We live in the 6th richest country in the world, and we can't pay our doctors a decent salary. Hang on. When they're all going to leave the country and go to Canada and New Zealand and Australia,
they do get a decent salary. They start their 3rd year on 55 grand a year. They get time and a half if they work more than 37 and a half hours a week. They get overtime if they work on social hours. They get overtime if they work weekends. They get one of the most generous pensions on the planet. They're not well paid. But to ask to get 22% last year and to ask for 30% this year is greed, because it's going to come out of taxpayers' pockets and it's not fair.
Okay, let's go to... Well, I guess if it comes out of hospital trusts, the hospital trust will be able to pay fewer. They'll have fewer doctors who are paid more. That's what it'll do.
That affects patients' care directly, as does their strike.
Sharon is in Lincolnshire. Sharon, what do you think? We're just looking at these numbers here. Do you think that's about right? Because it brings them back to where they were?
Well, I would give them as much as we can, but at the moment we are we can't afford it. There are people that need our help, not just doctors and nurses, but everywhere. Everyone needs a pay rise. Everyone wants to be happy and can go out and afford to buy food and heating and everything. But we just can't afford to keep doing this. We keep going on and it's just getting ridiculous.
Well, Labour said that they would get growth and growth would pay for what they wanted to do. But the growth is coming in fits and starts.
Yes, and we just can't do it at the moment. Maybe in the near future, I'd love to give, everyone, doctors, nurses, people that try and help us and save us, I'd love to give everyone a pay rise. But they just seem to be holding us to ransom so that, if we don't if we don't do this, then we're going to go out on strike,
Yeah.
and then people will suffer.
Phil, do you think it's right?
And it's
Because this
just
is,
not
let me ask Phil,
fair.
is that holding us to ransom, Phil?
Well, look, this country has never been richer. We're 3 times richer.
Is that
than
true?
It's absolutely
we've never
true.
been more in
We're
debt.
3 times richer than we were in the 60s.
1%
The
growth.
difference is that rich people, the super rich, I'm not talking about millionaires, they're talking about billionaires. There are more billionaires now than there were millionaires in the 60s. That's 1,000 times more money. The money is so concentrated amongst a very, very tiny number of rich people. We
Who have
are the
earned it.
6th richest country in the world. Where is all the money? The rich have got it. We
Okay.
need to
Keith
take the
is
money
in
from
West
the rich
Sussex.
and
Keith-
give it to our services and to poor people.
Thank you, Sharon. Keith in West Sussex, what do you think of that?
I think it's ridiculous. Look, I'm a pensioner. I've just had an extra 25p a week because I'm over 80. Now, my pension doesn't allow me to do the things that I used to do when I was working. Obviously not. If I spend money now, I can't get it back. But these people, 29%, is utterly ridiculous.
Do you think they're going to lose public sympathy, Keith?
Sorry?
Do you think they'll lose public sympathy?
No, I don't think he loses public sympathy. I think these people have got to be realistic. 29% is ridiculous. We're going to go back to like it was in Hitler's time. We'll be walking about with barrel loads of money, but it's going to be worthless.
Well, if the government prints money, we would. I mean, it's more likely they'll find it as savings, I guess.
We need to get rid of this mythical fantasy figure. They say that they're trying to bring the level up to what it was in 2008. I'm sorry, their figures were calculated from the retail price index rather than the consumer price index, which is the wrong thing to do. And analysts have rubbished this now for years, but they keep on using it.
Isn't it a negotiating position?
No,
Surely
what it is, it's
we
greed.
had a massive inflation spike, and that's what's caused all of this.
Yeah,
and
but
it was post-Ukraine and COVID.
One of the first things Rachel Reeves did when she got into power was give them a bumper pay rise. She gave them the 22%. Wes Streeting said,
you didn't
that's
like
it
that,
now.
did you?
No, I don't think anyone deserves 22% pay rise at a time the country is struggling.
Well, it's not really a 22%
this government
pay
stuffed
increase
their
if
mouths
inflation
with
has
gold.
gone up much more.
This government stuffed the junior mouths with gold last year, and now they're demanding again this year. And their strikes have empowered them to do
What job
that.
is more
Their
important
military.
than being a doctor?
Oh, please, people, don't denigrate other people's jobs. People
I'm
stacking
not,
supermarket
I'm not,
shelves,
I'm
lorry
not. I
drivers,
think all
they
jobs are
all do
important.
vital
But
jobs
being
to
a
keep
doctor
this country
is
going.
crucial.
Being a doctor is crucial.
And they get
Okay.
paid very well for it.
Keith, thank you. Richard in Buckinghamshire, who's right on the panel here?
The guy on the right is clearly doing all of his research on the internet because it's rubbish. I'm with Carole. It's 100% absolutely not acceptable for a 29% pay rise because that would make 50% in the last 2 years.
Exactly.
So any junior doctor who wants 25%, show them the dole queue and tell them to bugger off.
Yeah.
Well, we had the phrase bugger off on the show yesterday. I don't know if it's... That's really weird.
But think about it.
I never know if it's acceptable.
Nurses have been offered, I think it's something like 3.6%
They should get
this
more.
year. Yeah, but the thing is, do you think they're not going to go on strike if the doctors get anywhere near 30%? They're then going to go on
But
strike.
isn't the problem... Your argument is destroyed by the fact that every time the MPs get a chance, they give themselves a pay rise.
They don't give themselves a 30% pay rise.
Well-
and they certainly don't give themselves a 50% pay rise in 2 years, that's for sure. But this is just greed. It's because they know they have clout. They put people's lives on the line to get more money. They did it last year. They had 20 strike days last year. People's lives are put in danger by this. And taxpayers have to foot the bill, and it's not fair.
After the
Just
break, we're
not
taking
fair.
more of your calls on whether junior doctors are greedy to ask for this 29% pay rise. 0207 862 2222. Now more of your calls on whether junior doctors are getting greedy because it's 29% they want. Let's just show you this again. I'm going to bring it over because it's a very handy little graphic, this, and it's kind of stark, isn't it? The numbers here. So this is the crucial one. This is Rachel Reeves' settlement, 22%, then 5.4%, and people thought job done, £38,000. Now the demand comes in for 29%. And as our last caller said, right or wrong, we do need doctors. Maria, in Manchester, we need them. I guess we're going to have to say yes to this.
Definitely.
Sorry, I didn't hear the
100%.
beginning of that. I'm so sorry. Go on.
Yes, definitely, 100%. I'm actually married to a doctor who's recently retired, so I've seen both sides of the coin, let's say. First of all, my husband, he was a specialist A&E doctor for many, many years, and just recently he's had a dissection of the aorta and an aneurysm. So I've seen the quality of care that's needed, and I've also seen how hard that the doctors work.
So what? So your husband? Did you say your husband has had? I know dissection of the aorta kills about 50% of people who have it. So if he's still going strong, that's brilliant. And he had to have that care himself.
He had a dissection of the aorta. He had 2 major intensive care surgeries for that. And then also he had an aneurysm. He was given 5% chance to live. And on his last operation, it took a team of 18 in that surgery.
Right.
So I've seen the care that the nurses, that the doctors provide. And going back many, many years ago when my husband sacrificed a great deal, just of his own time as well, when he was working in A&E, he'd sometimes go back on the wards to make sure that those patients were okay and to see what happened to them. I'm going to put
Carole onto you because that is powerful.
It is powerful, Maria, but, going back and checking on patients, that surely is their job. Of course a doctor should check on his patients if they've had an operation or a procedure.
They go the extra mile. You said they don't care about the NHS anymore. That's rubbish.
No, I didn't. I said the BMA.
There's something very similar
Phil,
to that.
I did not. I said the BMA
say?
does not care about patient safety.
I think that's
I did
rubbish.
not say doctors do
They support their members. That's their job. They're a trade union. They
are
support their
trained
members.
to save lives. That's what they went into the job to do, to save lives. And I think that you will find that most doctors, after the 3rd year, get very well paid. They're in a higher bracket than most.
Is that right, Maria, by your experience?
Carole,
yes.
When my husband was training, my brother, as a lorry driver, was on more money than my husband that had trained for several years.
How long ago was that,
Maria? He was doing shifts, I'm going back about 15 years ago, but he was on more then. But if you look on the pay rises for junior doctors, they haven't, this is just like backdating it.
No, it isn't. No, I explained that before. The figure that the BMA gives out all of the time is this mythical thing from 2008. It's been disproved time and time again because their calculations are based on the retail price index, not the consumer price index, which is what it should be. It is a mythical figure.
There's not a lot in
last
it
year, the
way,
22% pay rise would have took them up hugely.
You say no, Maria?
No, it's
Where's
not
the money
at all.
going to come from, Maria, to give doctors a 22 to 30% pay rise every year? Where is the money going to come from?
They're not asking for it every year.
I don't think anybody will be asking Carole where the money would come from if it was your family that had a knife in the neck or something critical that had to be kept alive. If you've
of course you ask where the money comes from. Who's going to pay?
If you've got no doctors, then you're not going to be one very happy UK.
We're not going to have no doctors. We're never going to not have doctors.
You will end up not wanting people to come into the professional. You will end up where doctors are leaving. We've got really, really good A&E doctors, and they are leaving.
Okay,
honestly,
Maria, thank you.
in front of your noses, honestly.
And if they're leaving and going abroad, they should be charged for that because the bottom line is they're trained here and then they go abroad. And the
charged
reason,
for it? How do you do that?
Because they get trained here. But when they let me explain. When they go abroad
charged.
and they get more money in hospitals abroad, that's because they're not working for a National Health Service. Here, the wages are less than abroad because it is a health service. Abroad, it's not. It's private.
So maybe there is that thing where you work for the state, you work on a discount on the basis that you get a good pension and you get... I don't know.
If you take your skills elsewhere, haven't been paid for by here, you should pay something back into the system.
Well, yeah, but if you've done 7 years training or whatever, you've got a big student loan for that.
Not if you leave after 5 or 6 years.
Yeah,
you're not.
You do have to pay your student loan back, Carole.
Yeah.
Deborah in Surrey, hi.
Hello there, Jeremy.
Well, what do you think? Is it right that let's just remind ourselves, 29%?
They definitely deserve every penny that we can give them. My son is a junior doctor, so he's done 6 years at uni with a massive, massive debt. So he's already 3 years behind his peers of similar level.
Okay.
He's now done 4 years in the health service. And we are forcing them abroad. They're not choosing to go abroad for more money because he cannot get a speciality training post. It is a disgrace. People don't understand our doctors cannot get into speciality training schemes. He wants to be an A&E doctor.
Yeah.
He has got really good positive feedback from everywhere he works, and he cannot get a position.
I understand.
To train.
I think Wes Streeting made a speech about this 2 days ago, where he said we now need to say British junior doctors will be preferred into training places over already qualified foreign doctors. So they're obviously on. Thank you, Deborah. Sue in Worcestershire, hi.
Oh, yes. Good morning, Jeremy and Teeb.
Hi.
Hello.
How's your life?
Carol, I always agree with you, normally. On this occasion, no. Absolutely wrong. I've been in hospital loads of times. I want to say at least 50, I'm not exaggerating. I was rushed in and put into a coma, and the consultant came to me after 7 days and said, if it wasn't for these juniors, you wouldn't be here. I was then had a major operation, 9-hour operation, and one of the junior doctors stayed with me all night, never left my side.
So I get that. Listen, I completely get that. And everyone who has a story like yours would feel that. But the bottom line is they are doing their job. That's what they're paid to save your life.
To have, Carol, seriously. Could you do it? I couldn't.
No, I couldn't do it. But I didn't choose to do it. They did. And they chose to go into a profession that saves people's lives.
It's not a job, is it, Carol? It's not a job. They go into it because they want to keep people going.
In which case, why are they demanding this
because they don't want to work for peanuts. And I'm tired of hearing this line, we haven't got enough money.
Hang on, Sue, hang on. Sue, I'll come back to you, Phil.
I'm tired of hearing this line that we hear from half the population now, that we haven't got enough money. We are the 6th richest country in the world.
The 6th most indebted, probably.
No, the 6th richest country. Our debt is no bigger than many other countries. We're the 6th richest country in the world. There's plenty of money. It's just the rich have got it.
We have a health service that costs more than most in the world.
And we can print money because we're not in the
No, we haven't.
Euro.
We spend less on health than the average in Europe.
No, we don't. No, we absolutely do not.
After the show, I will show you the
I've got my own.
Sue, go on. Sorry.
You know what? Honestly, I'll go in.
Go on, Sue.
I go into our local surgeries and I train to two-year junior doctors. I go and talk about the things I've had wrong with me and what have I done and how brilliant they are. Now, I do that because I like them and they need this money. They come in, I talk to them.
Right. I tell you what, tell them about this call because they'll love that. Thank you, Sue, very much indeed. Thanks for all your calls. Before we move on, I've got to correct the record about something earlier on. Carol, you said doctors can earn £250,000
when they get to be consultants,
after 7 years in the job. That's what a senior consultant might make, and it would not take 7 years.
That's what a consultant might make. But if you add overtime on, I'm not talking... Now, what I made clear, that is not just their wage, it is overtime. And they get overtime if they work more than 37 and a half hours a week. They get it if they work on social hours.
I'm really glad I made that correction.
Which is 9 p.m. Well, but it's not true.
No, all right.
They get a lot of money.
There is a circumstance in which someone could earn... All right. Well, yeah, we'll call that a score draw.